Have you ever felt like you're just drowning in information, maybe facing a really critical problem where the systems that are supposed to help just feel, well, broken? Imagine being a new parent, totally overwhelmed, exhausted, and trying to figure out the healthcare maze. It's such a vulnerable time. That feeling, that need for a clear path, like a shortcut to actually being well informed and cutting through the noise, that's really why we do these deep dives. Today, we're getting into a topic that touches so many lives, the urgent maternal health crisis. But we're not just here to sound the alarm again. We're going to unpack a really innovative, community-driven solution. Our deep dive focuses on Esther. It's an AI companion designed specifically to support mothers, starting with that critical postpartum period. Our mission here is to show you how this project aims to tackle these deep health disparities, challenge the usual tech models, and really empower communities. And it's doing all this through a pretty radical open source approach. We've pulled together information from product meeting notes, public repositories like GitHub, and even personal insights from the founder herself to give you the clearest picture.
Yeah, what's really striking in the sources is how they paint this picture of a healthcare system under, frankly, acute distress. And this specific solution, Esther, it really comes across as a direct, very thoughtful response to those deep systemic problems. It helps us understand not just what's happening, but the why behind it all, and maybe what a different future for healthcare could actually look like.
Okay, let's unpack this then. The maternal health situation right now.
hmm
It's facing immense pressure. We're seeing a system where vital services are just collapsing, programs get cut, funding disappears, moms lose access to care, it leaves whole communities behind. We've definitely, raised awareness, sounded the alarms. But now comes the next step, building real solutions. So what are the specific pain points Esther's designed to hit?
Well, the pain points are pretty stark and pervasive. Globally, but especially in the US, we're seeing maternal mortality rates actually rising. That's just unacceptable. Beyond that huge issue, there's the problem of how some tech companies have, historically, exploited vulnerable groups for profit. Data mining that takes value but doesn't give back meaningfully to the communities it comes from. And this often creates exclusive solutions that actually make health disparities worse, not better.
And these aren't just abstract failures, right? They hit incredibly close to home for people. The founder's own story really underscores the gravity here. Lauren Weichert, who founded Trimester's AI, she's talked openly about her struggles navigating the system while uninsured or underinsured, trying to figure out Medicaid. She describes this cruel irony of being called non-compliant when the system itself makes it almost impossible to comply, and how privacy, as she puts it, becomes a kind of privilege, not a right, when you're in that position. She even shared a really intense experience from her first pregnancy, severe hyperemesis gravidarum.
Oh, that's extreme morning sickness, basically.
Exactly, like can't keep anything down, not even water. It was so severe, she actually weighed less after giving birth than before she got pregnant. It really brings home the intensity of the challenges mothers can face.
Yeah, her experience is such a powerful anchor. It connects that human reality directly to the systemic problems Esther's trying to fix. It's like the foundation for the whole project's understanding.
So, enter Esther. You described it as a compassionate AI assistant, designed to support people through postpartum with personalized, medically informed guidance and emotional support too. And its initial focus is squarely on postpartum recovery. That idea of keeping development minimal is interesting, especially in tech where everything is usually about scaling fast. What are the risks of not being super precise in maternal health tech? How does being minimal help avoid those?
That precision is absolutely fundamental. It ties right into Esther's core philosophy. I mean, the biggest risk is building something based on assumptions, thinking you know what communities need instead of verifying it. That can lead to tools that are overly complicated or just don't work, or worse, could even be harmful. So by keeping Esther's development minimal at the start, they make sure it meets the actual identified needs of the community. Then it can grow based on real feedback, real utility. It's an approach that aligns with what are called digital public goods standards.
Digital public goods standards. That sounds like a really powerful concept. What exactly does that entail for Esther's mission? Why is that so crucial here?
Right, it's not just a label. Digital public goods, or DPG compliance, it's a real commitment to building essentially a digital public utility for health. Think of it like, ensuring clean water is accessible. This is about making sure critical AI tools are built and shared openly, designed for global impact and local adaptation, not just private profit. So it means Esther needs to be relevant to global health goals, use open licensing, they use the MIT license, have a clear documentation, and crucially, address dependencies. Like, if a tool needs specific hardware, you have to ensure there are affordable, accessible alternatives. The product can't be limited by things people can't access.
Ah, okay. So it ensures broad accessibility.
Exactly, especially in underserved areas, which is critical because honestly, the current progress on maternal health in the U.S. is moving in the wrong direction. Esther's mission reflects this. It's ambitious. Improve maternal health outcomes by providing continuous personalized AI support to 5 million underserved mothers by 2030.
Okay, beyond the philosophy, let's talk practicalities. This open source model.
Right.
How does a project like Esther really open up its development? Especially to people who aren't coders. You mentioned GitHub. How does that actually work for, say, a concerned mother or a community health worker?
It's genuinely transformative. The founder said, the room where it happens isn't just our Thursday meetings, it's the Esther repository on GitHub, and it's open 24/7. That's where the real decisions are shaped. Community members can go there, request features, point out problems, really influence what gets built. And you absolutely do not need to be a coder.
Right.
You just need to care about maternal health and want to contribute. It fosters this kind of radical transparency and genuine community involvement. It's about collaborative innovation.
That level of transparency is pretty rare in the tech world.
Yeah.
So how do they put this philosophy into action? Is there a specific example, like a case study, that really shows this approach at work?
There is, yeah. And it's a really powerful one. It brings us straight to the Rockford Initiative.
Perfect. Let's zero in on that. The Rockford Initiative. Trimester's AI, Lauren Weichert's company, is based in Rockford, Illinois. And Lauren realized her community had, as she put it, very, very, very specific and unique needs. Needs that were different from other places, even within the U.S. What makes Rockford such a significant place to start this kind of project?
Well, Rockford has this well-documented history of systematic oppression, things like residential segregation, racial restrictive covenants. These aren't just historical footnotes. They have direct ongoing impacts on maternal health outcomes today. For example, Black mothers in Rockford face significantly higher rates of pregnancy complications, maternal mortality, and postpartum depression. Disproportionately higher. So this historical context is still very much a living force shaping health equity. It makes Rockford an essential starting point if you want to build something that truly works for everyone, especially those most marginalized.
So their design approach for Rockford is explicitly marginalized first.
Hmm.
The core idea being, if you design for the unique needs of Rockford's marginalized communities first, the solutions you create will actually work better for all mothers in Rockford. Can you give us some concrete examples of how that plays out?
Absolutely. So when they designed to meet the accessibility needs of mothers with disabilities in Rockford, say needing screen readers or different input methods, that leads to clearer interfaces, more intuitive navigation, which benefits all mothers using the tool.
Okay, makes sense.
Or if they solve for mothers who don't have reliable internet access, maybe designing for offline use or low bandwidth situations, they create solutions that are more robust for everyone, regardless of their connectivity. And designing for language barriers right from the start, that leads to AI that's more intuitive and culturally responsive for the entire community. It's basically universal design, but viewed through a sharp equity lens.
You mentioned earlier that AI systems themselves can sometimes perpetuate biases. How does this marginalized first approach in Rockford specifically try to prevent the AI from repeating those harmful patterns? And maybe more importantly, how does it build trust? Especially in communities that have, very valid reasons to mistrust medical research based on historical exploitation. I've heard the term reparative AI used. What's that about?
That's such a critical point because, yes, AI trained on biased historical data can amplify those biases, like underestimating pain in Black patients or misdiagnosing conditions in women. It's a known problem. A reparative approach here means they're not just building tech, they're actively trying to heal historical medical trauma and rebuild trust. How? By putting the marginalized communities in control, they are involved as leaders and designers, not just subjects providing data. The Rockford Initiative explicitly designs the AI to counter those harmful patterns. It acknowledges that history forced sterilizations, exclusion from trials that created justifiable mistrust. By involving the community deeply from the very beginning, they aim to build an AI that truly works for them, preventing bias at its source. It's about repair and respect.
And it goes even deeper with data sovereignty, right? You mentioned Rockford mothers actually keep their own data. It stays on their device, they choose what to share. That seems like a massive departure from the usual tech model of, data extraction for profit. This is a free community initiative. Esther isn't being sold to patients in Rockford, and their data isn't being mined for profit. That's huge.
It is absolutely a radical departure, and it's fundamental for empowerment. But what's possibly even more impactful is their approach to ethical data training. They use de-identified messages from Rockford mothers, with explicit consent, of course, to create what they hope will be one of the first comprehensive, ethically sourced datasets focused specifically on maternal health in a community with known disparities.
Okay, an ethical data set.
Yes, but here's the kicker. This anonymized, localized data set, it will be opened up for any organization or government agency serving Rockford mothers. This democratizes access to high-quality ethical training data. It prevents these data monopolies where only one company holds the key insights.
So it fosters community-controlled innovation.
Exactly. Where, as they say, no one gets left behind, it becomes a shared resource to benefit the whole community, not just a single entity.
So let's pull back a bit, looking at the bigger picture. How does what's happening in Rockford, this very specific initiative, apply more broadly? What's the potential blueprint here for the future?
Well, the Rockford model really represents a potential paradigm shift, this reparative approach to healthcare AI. It provides a powerful template, a model for community-controlled data sharing that actively prevents exploitation. It demonstrates, crucially, that ethical AI development can be economically sustainable. It doesn't have to be extractive. And it fosters a truly collaborative AI development process that serves communities rather than just taking from them. Ultimately, the lessons learned in Rockford, the approach itself, could help heal some of that historic medical trauma through ethical AI. And because it's open source,
It can spread.
exactly, it offers a blueprint with potential global impact.
Wow. This deep dive has really illuminated how an AI companion like Esther, built with this really radical community-first open-source data sovereignty approach, how it offers such a direct and frankly powerful response to the maternal health crisis. And the Rockford Initiative just exemplifies that so clearly.
It really does compel us to rethink how technology is normally built, doesn't it? And maybe more importantly, for whom it's built.
So it leaves you thinking, what if the future of technology isn't really about that centralized control and corporate profit model we see so often? What if it's about decentralized power, real community ownership, and actually using innovation to heal historical harms, to ensure everyone, starting with the most vulnerable, truly gets covered? What might that look like in your own community? Something to think about.